Okay, let's get started with our next speaker. So, our next speaker is Ahmed Nawaz. He is a national trainer and program associate with 10 years of experience in the fields of drug demand reduction and HIV/AIDS prevention, treatment, and care at the United Nations Office on Drugs and Crime in Pakistan. As a trainer, he has instructed professionals on school and media-based prevention interventions and has become skilled in delivering meaningful programs related to quality assurance, capacity building, and advocacy to improve drug treatment services. He has also coordinated projects to improve HIV, hepatitis, and tuberculosis services in prison settings. During this Humphrey year, Ahmed plans to work with US-based experts and organizations to enhance his skills in developing and managing effective policies and strategies related to DDR and HIV/AIDS in order to better advocate for marginalized populations in Pakistan. Please join me in welcoming Ahmed.
Good morning, everyone. Imagine being a parent with a critically sick son or a daughter who desperately needs treatment, care, and support during his sickness. And now, extend the same empathy to the millions of sons and daughters who are imprisoned for their substance use behavior without having a chance to heal themselves and get back with their families. I stand before you to talk for those millions of sons and daughters who needs treatment and not imprisonment. And I will talk about the potential benefits of alternatives to imprisonment for the substance users in Pakistan. Today, my discussion will revolve around three key points. First, I will look and share with you the substance use and criminal justice situation at global level, and then we will look into the situation in Pakistan. Then we will look into the alternatives to imprisonment options that can be adopted in Pakistan. And then I will share with you the three benefits of alternatives to imprisonment that will be adopted by Pakistan government. Let's look into the substance use and criminal justice situation around the globe. 2023 report by Sayer and Wagner revealed that the major cause of imprisonments around the globe today is this drug-related offenses. Surprisingly, in 2023, Penal Reform International and Thailand Institute of Justice revealed that 2.2 million people around the globe are imprisoned for drug-related offenses. And among these 22%, among these 2.2 million, 22% are the people who are imprisoned for having drugs for their personal use, which means that these 22% of the population are the ones who are addicted to drugs, who are substance use dependents, and they need proper treatment. Now, let's look into the situation of substance use and criminal justice in Pakistan. A report by the United Nations Office on Drugs and Crime in 2023 revealed that 6.7 million people in Pakistan used drugs in the year 2012. That accounts for a total of 6% of the population between the age of 15 and 64 years. And this 6% of the population includes 4.25 million people who are dependent on drugs and they need treatment. Even the prisons face various challenges in Pakistan. So the Institute for Crime and Policy Justice and Birkbeck University of London reported in 2023 that Pakistan has overall 116 prisons that has the capacity to take overall 64,000 of prisoners at one time. However, they are occupied by 87,500 prisoners in the year 2022. This means the prisons in Pakistan are overcrowded and overoccupied by the prisoners, which is 136% of the overall prison population. To reduce the overcrowding issues around the globe, there have been various interventions adopted by different countries. But keeping in view the situation in Pakistan, I selected two interventions to be implemented in the Pakistan context. Number one is the pre-trial rehabilitation program. These programs will not only help in alleviating the prison overcrowding, but will also help in reducing the burden of disease of substance use disorders in Pakistan. The first one is the pre-trial rehabilitation program. This is a rehabilitation and reintegration program for the people who commit petty nature of crimes. So the petty nature crime offenders, they are not sent for the trial. In fact, they are sent and given a chance to go into the rehabilitation and reintegration activities and have a chance to get back to their families and reintegrate into the community. However, in this alternative, the court has the power to authorize or deny the participation of an individual. Now, I will go to the second alternative, that is the drug treatment alternatives to prison program. This program uses the deferred sentencing model. It means that the sentence that is being given by a court is deferred for a certain time, and the non-violent drug offender that is sent into the community-based drug treatment service center, where he spends 1 to 2 years of his life. And once he successfully completes that program, he gets a chance to dismiss his case. If the person is not able to complete the program successfully, he reports back to the court, and then he is sentenced with his offense and sent to the prison. So the main idea behind this intervention is to give another chance to those millions of sons and daughters who needs treatment. There are various benefits of the alternatives to imprisonment, but for this presentation, I just selected 3 of them. The first is the effective and sustainability of this program. In 2013, Belenko et al. Reported that the individual who successfully completed the alternatives program were having less reports of drug use and criminality behaviors. It means that these programs are effective and sustainable. So once a drug user or a drug offender gets treated and reintegrated into the community, there will be a less number of chances for him to come back again to the prison. So it will also help alleviating the prison overcrowding. And last but not the least, it's a human rights and community-based approach. So with this alternative, we are promoting reintegration and minimizing the negative effects of substance use and prison settings onto the individual and the community. So, to review that, we looked into the substance use and the criminal justice situation at the global level, and then in the Pakistan scenario, and then we looked into two different alternatives to imprisonment, and then I shared with you the three of the potential benefits of alternatives to imprisonment. I would like to conclude my presentation by a statement that by recognizing substance use disorders and adopting alternatives to imprisonment, we can address various challenges such as alleviating prison overcrowding and minimizing the negative impacts on individuals and their families, and as a whole on the community. I thank you all for listening to me today. And if there is any question, please go ahead. Thank you.
Are there any questions from the in-person audience or Zoom audience? You can also ask questions and we will relay them.
Yep. Yes. Yes. So for that is for basically for the people with petty nature crimes. So when a person is dependent on drugs, on a substance, he will go and like snatching kind of activities. He will go shoplifting. So in that scenario, that is called a petty nature crime. So in that scenario, he has an option to go into the treatment, and his case is not being sent for the trial to the court. So he goes to the treatment facility outside the court first. Yeah, so he is given another chance to go into the rehabilitation process. Yeah. Yes, this is basically a program that needs proper treatment. The patient has to be there for a certain number of days, and once they are assessed and thought to be successful completers, then they are good to go back to their families. Yes, there is a dire need of establishing these treatment facilities, which is also a challenge in Pakistan. We have not a good number of treatment facilities even for the general population. But the priority should be the prisoners, because it's causing various challenges even to the government at the judiciary level, at the criminal justice level, and also back to their community and their families. Yeah.
Kind of a follow-up question. Who pays for these treatments?
So the government has to facilitate the treatment process and pay for these services, because initially Pakistan have been receiving fundings for these drug treatment services through NGOs, but now since there are no, I would say, a good number of donors that invest into the drug treatment systems in Pakistan, except US. So the government has to look into the possibilities of establishing treatment facilities for these people.
Thank you for your presentation. I strongly agree with your proposal, especially as the first option of rehab. Could you share some positive examples of a country successfully used this alternative?
So these programs have been successfully implemented in the United States. in 2013. And after that, Singapore adapted these interventions, and various other countries also. So the US is the first one who went into adopted these alternatives. Yeah. Yeah. Yes. So basically, as we say that the drug use is a multifactorial health disorder. So it has various factors that are pushing him towards the substance use behavior. So every aspect of his life has to be positive and to bring that person out of the addiction. If a person is given a chance to go into the treatment, and that person successfully completes the process and go back home, and then again that person relapses and again comes to the treatment facility, then that person has to be sentenced with that crime. So at least one chance should be given to every individual. Yeah. Yeah. Okay. So the treatment depends on the individual's situation. So whenever a person with substance use dependence comes in, and the psychologist or the counselor assesses that person, so it all depends on the assessment, whether that the person is using meth, whether the person is using opioids, or even there are so many kind of drugs. So this all depends on the assessment of every individual to individual. But for the opioids, like in Pakistan, we are piloting now, and medically assisted treatment that is being piloted for the first time in Pakistan, which is very cost effective and also sustainable and effective for treatment of opioids. But every drug has its own treatment type and treatment services that are required for the patients. Prevention. Yeah. So currently, in the context of Pakistan, I would say that we are reactive and not proactive. So for the drugs, we need to be proactive, because if we are not going to be proactive and we are not working on the children that we are raising in our schools, at our homes, and we are not being proactive for them and prevent them for drugs, eventually they will be at risk when they grow up to 16 years of age or 17. So prevention should be the first step, but unfortunately, up till now, we are not taking it serious, and we need to take it seriously, because it's not an issue of one person or one family. It affects the whole community around that individual. So the proactive approach will be more helpful than the reactive approach. Thank you.
Time for one more. We've got a good one.
So Roma asked, what criteria would you propose the government use to select or prioritize these individuals for rehab since they will not be able to attend for
Sorry, come again.
Yep.
I can paraphrase. How will the government prioritize who gets treatment and who doesn't, since it seems they won't be able to take everyone all at the same time?
Yes. So the priority should go for the people with petty nature of crimes, because these are in very miserable condition. They are doing that crime not to benefit back their home, but they first want to benefit themselves. So we need to prioritize the people with the petty nature crimes that are into drugs and need proper treatment. Yeah, thank you.
All right, thank you, Ahmed.